Hey folks, thanks so much for joining us here on We Should Talk About It. I'm Myra Ansari, and today we have a new guest with us. This is Susan Dunn, the Susan Dunn. She has earned this title, and Susan messaged me because she thought about something that she does in her career that is connected to mental health, and we got to talking about this. You're a physical therapist here in the Louisville area, and you focus a lot on pelvic floor issues and the connection to that in mental health. This is really interesting because I don't think people put two and two together. How your pelvic floor is connected to your mental health. Let's talk about that.
Oh, there's so much to talk about. Pelvic issues, in my mind, are orthopedic issues, at least the things that we deal with. And we don't get, if you have a knee problem or a back problem or a shoulder problem, it makes sense. You rule out all the bad stuff. You don't need surgery. You probably need physical therapy. And there are so many diagnoses within the pelvic area that come down to muscle, nerve, bone, joint, and that's what we treat. The difference is when someone has a knee issue, they don't get all up in their head. I mean, unless they're an elite athlete and that's what they make their money doing and they need that. But it gets all up in their head because it's like, what's wrong with me? Why am I defective? And it becomes, it's crazy. Divorces have happened over this. I can't tell you how many. I've been doing this for more than a quarter of a century and have treated thousands of patients. And the stories that you hear, for example, pain with intercourse, so easily treated the majority of the time. And yet they go through years of pain and just trying to suck it up and try to have sex, and what's wrong with me and why is it hurting? And then the partner is thinking, well, they're just not into me anymore. And then it becomes this whole vicious cycle. And it's so often easily treated and people just don't know about it.
Yeah. Let's talk about a little basic anatomy right now. I'm going to pull up a website from the Cleveland Clinic, and Susan, kind of walk me through what we're looking at. Our pelvic floor, where it is. Men and women, we both have pelvic floors.
We do.
What is the purpose of it?
The purpose of well, first of all, to demystify it, because I try to get my patients to not think of it as an area of genitalia. Myra, I understand that it is a private area, personal area. You don't sit around at the Thanksgiving dinner table talking about this type of pain. But I really try to get them to think of it orthopedically. So the muscles that you're looking at, those are just plain old muscles, like your hamstrings, your quad, your bicep. It is absolutely no different than any other muscles that are taken to physical therapy. And their three main functions are sexual function, support, and continence. But also we see just as many patients that the muscles are so tight that they can't evacuate. So they have constipation or they have urinary retention. If the muscles are tight and contracted, it basically, think of a garden hose in your backyard. If you kink a garden hose, there's nothing that's going to come out of that hose.
Yeah.
So we have the retention, constipation people. Then we have plenty of patients that have incontinence. And then sexual dysfunction. For our male patients, painful erection, painful ejaculation, female patients, painful penetration, inability to orgasm. That has nothing to do with, and obviously you have to be screened by your doctor. So you have to
have a diagnosis.
Yeah. And so the hormone levels are fine, but the health of these muscles have so much to do with with your ability to have sex and quality of sex and non-painful.
And it also is not just sex, but say if you're going through incontinence too.
Yes.
Okay, I like to be transparent, so I'll just say it because I'm about to be 46. Like I'm kind of hitting in that range, like where all of a sudden I'm walking and I'm like,
what was that?
What was that?
What just happened there?
What just happened? And it's just like it's moment of panic, and then you're wondering what's happening with my body. Why am I losing a little bit of control here?
Yes.
What do I do? And
I'll tell you what, yes, it's hard and it's embarrassing to talk about. I've been a patient and I do this for a living. No one's immune to this. And if we don't talk about it, even with our own healthcare providers, we're not going to get it addressed. I'm not saying this to like get a ton of patients out of this. And the next statement I'm saying is the truth. If you have incontinence and you don't address it, it won't go away, and it will get worse. And I say to my patients, look, let's fix the problem. And a lot of times it can be done. It doesn't have to be done surgically, although there are very good surgical options and pharmaceutical, but it can be treated. 85%, I believe, is the statistics of stress incontinence can be treated successfully with rehab.
That's interesting.
Yeah. So if it's only going to get worse, what do you want your reservation at Shady Pines down the road? Because here's the other frightening statistic. This is reality. What is one of the number one reasons that women are institutionalized in nursing homes in the United States? It's for this.
Really?
Yes. So of course, dementia and Alzheimer's, but right up there is incontinence. It becomes unmanageable, progress to diapers, progress to UTIs that get them hospitalized. And it's just a horrible, vicious cycle as time goes on. And so, yeah, I don't want my reservation at Shady Pines. So
I don't want to go to Shady Pines either.
Let's be proactive.
Okay, so when you think of incontinence, does incontinence impact men too? Is it men,
Yes.
women? Is it like, okay, I sneezed, or I just jumped, or I tried to run and a little bit came out? What are we talking about?
Okay, so men, the most common reason that they have incontinence is after prostatectomy. We see a ton of those gentlemen in the clinic. After a prostatectomy, and usually it's due to prostate.
What's the
They remove the prostate.
Okay,
And normally it's due to prostate cancer.
got it. Okay.
So they remove the prostate, which is a huge support of the urethra and continence for men. And so immediately after surgery, not only do they have complete erectile dysfunction, inability to get an erection, but they are incontinent. And here's the thing. I want all of my post-op prostatectomy patients to hear this, is that whatever function you had prior to your surgery, so if those gentlemen were continent and they were able to get an erection, that's where their rehab should take them post.
Okay.
Now, obviously, if before they had some issues already, post, you're going to get them just back to where they were before their surgery. But they don't have to live with it either. And that's just a part of it. You cannot escape those surgeries and not be incontinent and have erectile dysfunction after. And there is so much to be done to treat it post. But here's a really important message for any of you out there with elevated PSAs, which is the test that they do for prostate cancer. Preoperative rehab for pelvic, preoperative before a prostatectomy, before pregnancies or during pregnancies, before delivery, before any type of pelvic surgery for prolapse. That's extremely common. Preoperative therapy will give you a better postoperative outcome.
Okay. If you have a question for Susan and you're watching us live right now, please put it in the comment section. And if it's related to pelvic floor issues, mental health, I'll try to get it over to Susan so she can answer your question. Don't be embarrassed. Susan, I love how you're so comfortable talking about this. This is not a, oh, I'm not going to talk about what's happening down there.
Well, you know what? I did not pick this specialization. It picked me. This is, I always joke with my patients, my maiden name, and I'm not making this up, is Vagides.
Okay.
Yes, I know. I know. So any of the Vagides out there, those are my people. I did not pick this specialty. I was interested in orthopedics. And then the realization of how many women who are athletes that have issues, pelvic issues, and that drove my passion. And then I did a fellowship and all kinds of, I'm board certified in it. Now I forget what your original question. Oh, how easy it is to talk about it.
Talk about it.
Oh, it didn't used to be. When I first did my training, I couldn't even say, and I was much younger, I couldn't say sex without turning red. And I'm talking to these patients about this, but so I get you, people out there that are embarrassed to talk about it. I was there. I totally get it. But do talk about it, because my comfort level has come from over the years, how many people wish there were more people out there talking about it.
Yeah.
And and getting that knowledge and education, you do not have to live like this. You
Okay.
can get treatment.
We got a question. Kelly Powell, I love your question. She said great advice. So
Good.
that's wonderful. She wants to know, I want to read this out loud. What type of psychological issues come from a weak pelvic floor that produces pain during BM, bowel movement? Really great question.
It's a very good question. Pain with bowel movements. First of all, the United States has the worst statistics of any country on planet Earth for constipation, hemorrhoids, anal fissures, you name it.
Is it our diet?
It's our diet, and our toilets sit too high. When you poop, and I always apologize to my patients. I talk about intercourse, bowel movements, and urination all day, that I shorten it to pee, poo, and sex. So
it's all good. It's all
I'm
good.
not offending anybody. So when you poo, your knees need to be higher than your hips, and if it's not, your poop chute's not open, or for those that know what it's called, the anal rectal canal. And then you have to push it. But let's go back to the psychological part of it. Oh my gosh, you could talk all day about this, but if you can't get your poo out, there's panic, there's anxiety, there's stress,
You're
there's pain,
uncomfortable.
there's pain.
Yes.
And it's embarrassing, and you don't want to talk, and they start doing their own ways of treating it. So they go to the pharmacy, and then they get all these bad stimulant laxatives, and I mean, there's just all of these bad habits. And then we go back to the stress and the anxiety. I mean, by the time these people get to us, the things that we work on with them, not only are we working mechanically, I'm not a psychologist, nor are any of my colleagues, but we have to learn how to teach people how to down train the autonomic nervous system, the fight or flight part of the nervous system, breath techniques and things like that, so that we address the mechanical of why they can't get their poo out. And then also because the mind-body connection is huge. I don't care what injury you have in your body, it's huge. And if you're all up in your head about it, it's a vicious cycle of what can make things worse. So hopefully I answered that.
Kelly, hopefully we answered your question. If you need any more clarity, please shoot us a message here and we'll try to get that to you, because that's what this platform right now is for. I want to talk more, Susan, about the connection between pelvic floor issues, dysfunction with our mental health. Is it the fear of, I'm going to pee on myself and I don't want to leave the house, or I'm wearing a diaper and I'm scared that I smell, or what is the issue, the connection some folks face?
All of that. I see people, sadly, that, let's talk incontinence, since that was brought up. They know, of course, they don't want to leave the house. And this also affects their physical health, because normally they'd be out and about with friends and socializing or going to the gym. And I don't care how old you are or how young you are, but they become more isolated, and that becomes a mental health issue. There are people that I just had a few months ago, this patient that deep depression because she can't see her grandchildren. Why can't she see her grandchildren? Her grandchildren live overseas. She has the financial means to travel, but internationally getting adult diapers and all of that. So she'd have to pack so many, and it just became such a preventative thing.
Interesting.
That, yes. So that, so I'm like, dear God, I have got to get this person better so she can
see her grandkids.
See her grandkids. I mean, it's so individual for everybody, but it's also so universal. Nobody wants to have any pelvic issues. And it can, even though they physically can go and do things that they normally would do that would bring them joy to their life, they won't or can't do it because of their symptoms.
Interesting.
And it's devastating. And I will also point out too, the suicide rate, when we're talking about the pelvic pain patients, the suicide rate is present, is prevalent, is there. And it's not just with our LGBTQ plus patients that are dealing with pelvic issues, and we treat those as well in post-op vaginoplasties, after gender affirming surgeries. The male pelvic patients, male pelvic pain doesn't get as much attention. And the suicide rate for male pelvic pain patients is higher than any of the other pelvic diagnoses. And it drives me. It absolutely drives me and all of us that work at Pro Rehab who deal with these pelvic issues is to stay on top of our game, research, cutting edge, and getting out there and trying to educate as much as we can that there is help for you and not to let this drive you to that point of suicide.
That makes me sad that it gets that bad for some folks.
I'm going to share a story.
Okay.
So I think this is probably about 5 or 6 years ago, but I was treating a male patient for pelvic pain. And he had this pelvic pain, and because of HIPAA, I can't say the name,
Sure.
but had this for probably 10 years and kind of got the runaround. Would go to the urologist or primary care or whatever. And really there was nothing wrong with his bladder or his prostate. Nothing could be found. So it was alluded to this patient that it was in his head. I forget how he found me, but we started doing treatment. We were just in the very early stages. And then I get a call from his wife. And it was the first patient I ever had that committed suicide.
Oh my gosh.
And I mean, I didn't even know how to process this. And then she told me, and this is what drives me. And it's just, I've put the accelerator on since this has happened as far as my research and trying to be vocal, why I reached out to you to say, hey, we should talk about this.
Yeah.
We should talk about this. In his suicide note, he said that I was the only healthcare provider that took him seriously and listened. And now let me qualify. There are amazing healthcare providers out in the Louisville area that are nurse practitioners and MDs and PAs and PTs and that are all doing what I'm doing. But whoever he had and whatever his experience was, and and that didn't make me feel good. That made me feel sad, so we have to talk about this. I don't care if it's pain, sexual function, incontinence, prolapse. If people out there know what prolapse is, it's when your internal organs descend, they lost their support. For women, they can then begin to bulge out of the vagina. So then you have to push things back up in.
Wow.
For men, it can bulge out of the anus. You see it in young people, certain ways they exercise in the gym, heavy weightlifting, squats, and things like that.
Interesting.
Nobody wants to talk about it.
No.
And it needs to be talked about. And and we're here.
I'm glad that you're here to talk about it because hearing stories like that, remind us as well, Susan, that you have to advocate for yourself. If you feel like you are not being heard by your doctor, by whoever your healthcare practice, your mental health therapist, if you are not being heard, you have to shift gears and you have to find a person who is going to hear you, because a lot of the times it is not in your head. You are feeling it. You know your body better than anyone.
Absolutely. And a lot of times it starts with a physical problem, a real physical problem. They don't know that that's what it is, but it's an easy physical problem. And then it turns into a mind problem. And then you've got both going on, and then they feed each other. And then it's one of the things about, I have to brag about the PTs with Pro Rehab. I used to have my own practice. It used to be called Done Physical Therapy for a long time. And then I merged. I was always looking, because I'm getting older, and I'm always looking for who in my senior part of my career I could merge with and have them keep the standard of care moving forward. And that was Pro Rehab. So, and I have no regrets. And I've been with them since 2021. So we have, I want to say about 17, I think that's about right, trained therapists. And here's the thing. We have a network within Louisville that all of us therapists work with: psychologists, sexual health therapists, nutritionists, dietitians, that our patients, if we think they need that and they're not getting it and they're open to it, we will get them referred out to that. A lot of people don't know that there are sex therapist, and they think, oh my gosh, that's weird. And, like, are we going to be, what is this, like, Dr. Ruth? And although Dr. Ruth is amazing, but no, these are people that understand, and their specialty is dealing with sexual issues, and are very familiar with the work we do. So they complement each other really well. So I know I just went off on a tangent.
No. This is also interesting. Let's jump in on back to some of the issues with sex. If you feel like, okay, it hurts and something's not right, male or female, what does your pelvic floor, what role does that play into all of that?
Yeah. Well, first, be screened by your doctor. Make sure there's not something visceral going on that needs to be addressed. But on women, I cannot tell you. I always tell my young patients, I literally could fill the Yum Center with all the young women who never could put a tampon in, and then subsequently they can't have sex. And literally, it's just tight muscle. That's all it is tight muscle. And so that is easily treated. And then we fast forward to our perimenopause, menopausal. Sex used to be totally fine, and now it's different, and it hurts and it burns. And no matter how much lube I use, and our bodies change, muscles change, and that is extremely treatable as well. Not sure if I answered that question.
It can really create a gap between you and your partner too.
Oh Lord, yes. The stories I've heard over the years where it didn't hurt to have sex, now it does, and you don't know why. And then your partner is thinking, okay, they don't want to have sex because they're not into me anymore. And it's like, no, that's not it. It hurts. It's the proverbial, I have a headache, but it's not that, it really does hurt. And I literally, patients have gotten divorced over this when it is treatable. Talk about mental health with that. They second guess themselves sexually and what they're about and what they can even provide to the next partner. They will completely avoid relationships because they think, well, I'll never be able to have sex and they won't want me either. Oh my gosh, it's so crazy. And if we are not getting the education out there and talking about this, it's just going to keep perpetuating.
Okay. I just want to get back to clearing something up for Kelly. Kelly says, I was in a car accident, and after that, we figured out that all my stomach muscles were locked down in a Charlie horse, and they were not releasing. I was asking more about what would be the psychological manifestations when you're dealing with painful bowel movement. Does that make sense?
I think so. I mean, anybody that cannot, for whatever reasons, neurologic damage, the things that we treat as far as, we call it synergy problems between the muscles and when they should relax and when they should tighten. It doesn't really matter. Anytime you can't have a bowel movement mechanically, it doesn't matter the reason. There is huge psychological impacts with that. I mean, so I wish I knew more specifically, her particular case and what was going on with that. But
yeah. If you are joining us, I've put a link to Susan's profile at Pro Rehab. You can click on that and learn some more information. So when you talk about physical therapy, because that's what you do, how does physical therapy and fixing my pelvic floor issue go together?
So a lot of people don't come to their appointment because they're afraid. They're like, what is going to happen? Because usually when you walk into a physical therapy place, it's a big gym and it's open and treatment tables are out everywhere. But that is not how we do pelvic therapy. Pelvic therapy requires a private treatment room. So we have a couple locations that are dedicated almost 100% just to pelvic patients. And there's several private treatment rooms. And then some of our smaller satellite, but you'll always have a private treatment room. When we are trained in pelvic exam to check the muscles with the patient's permission. Now, also keep in mind, we deal with people that have been raped, traumatized, all kinds of trauma. And so we meet you where you're at. So we may not be able to do a pelvic exam on those patients. We will work on other things in surrounding soft tissue. So the most important thing is for people to know they'll come to the appointment. We will sit, we will talk, we'll understand your problem. We're not just going to jump and get up on the table and get undressed from the waist down.
Mm-hmm.
At some point, it's extremely beneficial to check the muscles, just like we would any other muscle in the human body. We don't want any exam to be painful. We're about the business of healing. So, they are used to, they have to go in, they have to get their pap smear every year. It's always miserable and painful, and they just suck it up.
Yeah.
And they think that's what it's going to be.
Okay.
No, we meet you where you're at and we take the exam. We can learn just as much by what you can't tolerate as what you can tolerate on that exam. So we don't have to push the tissue beyond that.
How do you do? Okay, I'm going to sound kind of
No,
stupid.
please ask.
How do you do physical therapy on your pelvic floor? I mean, I know that I know kegels.
Okay.
Right? Like that's
Yes,
as far
good
as I know.
Good question. Okay, so let's pretend it's a different body part. Let's pretend it's like a upper trap and someone has neck issues. So there will be stretches that we will teach you, and there will be stretches that are specific to pelvic floor. There are exercise, which is variations of kegels, hands-on therapy, manual therapy. This is the part that scares people, but I promise it's not weird, and we teach you actually how to do it. This could be anything from people with really tight muscles to, let's say, someone that has a lot of scar tissue after a episiotomy or vaginal delivery, and you have to work on massaging that scar tissue so that they don't have painful sex anymore, or they have better control so they're not peeing on themselves. So hands-on therapy, we glove up. We are working intravaginal or external. Intraanal if obviously on our male patients. So, and that's the part I think that people are like, oh my God, what is that going to be like? But I have been doing this for such a long time, and 99.9% of the time they're comfortable. They because they get results, they're feeling better, and we put them at ease. We want to make sure that they feel comfortable. So the other thing, and if I'm talking too much, just tell me.
No, this is so fascinating to me.
We train them and a lot of people don't know this, but they will be out in the gym, so dress comfortably. The diaphragm, which sits on the bottom 6 rib cage, and the pelvic floor, they talk to each other. So how someone breathes or doesn't breathe or holds their breath or is like a really shallow breather, that's going to be part of their therapy, because the pelvic floor is responding to what's happening to the muscles above it. And if they're dysfunctional, we're never going to get the pelvic floor functional. So they'll be like, why am I doing diaphragmatic breathing exercises, or why? And we explain it because they have to buy in. They have to understand the why behind an exercise, or they're not going to do it.
Interesting. Another thing, Susan, I want to talk about, because I'm sure a lot of relatively new mothers are joining us. So talk to me about how childbirth can impact your pelvic floor muscles.
Oh, huge. So one thing I highly recommend before you have a baby, I wish someone would have told me this, but back when I was young, right? Put your finger in your vagina, tighten your muscle. If you don't know what a kegel is, tighten like you're holding in pee and poo, and learn what your muscles are doing before you have any trauma.
Okay.
Because I can't tell you how many pregnant postpartum women come in for incontinence, pain with sex, or any fecal incontinence, even if they have a 3rd or 4th degree tear. And we'll do the pelvic exam and they'll go, well, how much did I lose? I'm like, well, I don't know. I didn't meet you. I didn't check your pelvic floor prior, right? So, right. Check your own vagina, and patients will say, oh, that's so weird. No, it's only weird if I tell you to go check your neighbor's vagina. You're checking your own vagina.
Check your own.
Check your own. One finger vaginally, right? Find out what you got going on there. So postnatal, there's scar tissue healing. Sometimes it doesn't heal smoothly, and it impacts the ability for the muscles to tighten. The muscles are stretched out, they're weak, we've got to get them stronger.
Okay.
And so, and even post C-section, I had all my children C-section.
I had my kids C-section too.
And well, you've already admitted, and I also had urinary incontinence. And you're not immune just because you had C-section.
So that can come like my kids are 11 and 9 now. Is that a result?
Yeah.
Sometimes.
Yes, it can be. It can be a slow, delayed, resolved, like there wasn't as much damage as obviously a vaginal delivery, but enough. We ignore it. We're fine. And then we go through life and maybe we're not paying attention to our pelvic floors. So it atrophies. Here's the comparison that I always do. Every spring, we're coming up to spring and summer, you go to put on those short sleeve shirts and I see my triceps and I'm like, oh Lord, girl, I got to do some tricep, right? Out of sight, out of mind.
Yeah.
It's covered up all winter. It gets atrophied, right? Well, the pelvic floor is out of sight, out of mind. And we don't notice it till we start having symptoms. And then you're like, oh, okay, that's been getting weak all along.
All right. So you mentioned just kind of being aware of our own body. I'm going to be comfortable talking about this.
We have to be.
Okay. So putting your finger up in your vagina. How do I know what I'm supposed to be looking for?
Good question. And I teach all my patients this. It's not rocket science. When the pelvic floor tightens, there are 3 things that you should feel if you have a really good, strong pelvic floor. The pelvic muscles will squeeze together on your finger. They'll lift up into your body. And then with your finger up in there, it will bend the distal part of your finger a little bit. So
I'm just visually trying to.
Okay. Picture this. Picture this. Stay with me here. You're in the backyard and you've got a garden hose.
Okay.
And you want that garden hose. You can't go back and turn the water off, but you want to turn the water off.
Okay.
What do you do to a garden hose to stop the water? You kink it.
Kink it, yeah.
I don't agree with the design, but nobody asked me on the evolution of the human body. So that's what we have those. So the urethra normally pointing down, right? If we're up and about. And what the muscles will do will kink off the urethra.
Okay.
Well, if our muscles are weak, maybe you'll get a squeeze. We'll picture that garden hose. It depends on how strong the water pressure is. So the water's coming out, it's not very strong. You can get away with a squeeze and you won't have any leakage. But if the water pressure is strong, or let's say your bladder is more full,
okay,
then there's more pressure. So you've got to be able to kink the hose.
Okay.
What most people will feel, I'm just telling you, everybody listening out there, please do this, right? Finger up in the vagina, do a squeeze. And if your finger is not getting bent, then you're at risk for some incontinence, depending on how many times have we heard, I can't do jumping jacks. I can't jump on a trampoline. I can't do those things. It's just too much pressure.
Yeah.
And the muscle doesn't have the coordination or the strength to kink it off. So those 3 things, squeeze, lift, bend, or squeeze, lift, kink. And you got that, you're good.
Okay. If anyone out there is listening to this and finds himself in their head practicing.
Yeah.
You're not the only one.
Far off look in the eye.
I'm like, okay, we're gonna try this. I'll just admit it because I am. Okay. Don't judge me.
I hope everybody is.
Yeah.
Like they're sitting there going, okay.
Yeah.
Like if you're sitting in a chair and you're out there listening and you're doing a kegel, first of all, please let me tell you, your butt cheeks, your gluteus maximus is not part of your pelvic floor.
Okay.
Okay. So if your booty is squeezing, all that's going to do is give you buns of steel. That's not going to help strengthen your pelvic floor. So you should feel the anus, the vagina, the urethra. And if it's really strong all the way to the clitoris, you should feel a pulling up and in.
Okay.
Right. So don't get other muscles involved. People like to cross their legs and people like to squeeze their butt cheeks. I always say you should be able to sit like me. I should be able to sit here in front of you, Myra, and be kegling, and you shouldn't know it. You should be able to sit in church or at a meeting. And if you're sitting there and things are twitching externally, you're doing it wrong.
Okay.
Okay.
If you're bouncing up and down, you're doing it wrong. Yeah.
You're doing it wrong. So you should be able to clearly feel the holes down there closing, male or female, and right? But nothing else. Nobody should notice.
Okay.
And then you've got a good isolation.
Hey, just do one right now.
Right?
Or a couple. No one will know.
Men and women.
Men and women.
Men.
Okay. Oh, I feel like, Susan, it's actually like a breath of fresh air to be able to talk about some stuff that people think is taboo or I'm embarrassed. We have this, I think, in our society, just like, you don't talk about anything
Mm-mm.
Down here,
No.
back there, it's off limits.
Yeah.
I don't want to admit to everybody that I was walking down the hallway yesterday and I peed a little bit on myself, but it did happen. And I ran quickly to the bathroom and was like, oh God, like
Right.
panicking.
And you're not alone, because it's literally, you could go out and the next 20 women that pass on the street, I'm going to tell you right now, the majority of them, 70%, have some type of pelvic issue. Here's the other thing. I give a lot of talks and I love teaching on this. And I will say to a group of women, I'll talk about, incontinence. And you can see this look on their face of like, well, that's not me. And then I'll say, if you sneeze and you leak, well, people think, well, that's normal. I'm not incontinent. I'm like, no, that's incontinence.
Yeah.
Urine or poo should not come out unless you choose for it to come out.
Mhm.
So even if it only happens once a month, people will put on their medical history, no, I don't have any urinary incontinence. Well, do you ever leak when you sneeze or laugh really hard? Well, yeah, well, no, there's no but.
Mm-hmm.
It's incontinence. You didn't do that when you were a kid. Now, just very briefly, and we won't go into all that, but we do have a pediatric program.
Okay.
Parents need to know about this. Bedwetting. A huge percentage of kids that wet the bed is because they're constipated. Fix the constipation and you fix that problem.
Interesting.
Yes. Now, there are other reasons for
Sure.
bedwetting. And then other pediatric bowel and bladder issues are also very treatable. And we have a pediatric program at a couple of our locations. But anyway, I forget what we were talking about.
No, it just it can affect children as well. It's not.
Yes.
It's more than likely. You were mentioning that sneeze or that jumping jack, or maybe I don't want to go to the gym anymore because I'm scared I'm going to pee on myself,
Right.
or I'm walking and all of a sudden I felt something in my underwear that wasn't there 4
Mhm.
seconds ago. Like, what's happening?
Right.
And
right.
it could be just that little dribble, but it's enough to make you go, oh my God.
Yes. And on the pediatric side of it too, talk about mental health. These kids, when they can't do sleepovers, or they can't go to scout camp, or they can't do these things because of their bowel and bladder symptoms, the depression and anxiety with these kids, it's heartbreaking. And there are so many options to treat, and they don't often think about the physical therapy part of it. So
That's interesting. That could be a
Yeah.
whole other day we talk about that, Susan. Okay. I feel like this is so interesting. I feel like folks watching this, if you're thinking, okay, I'm having issues in the bedroom, I am peeing on myself, even a little, or whatever it may be, physical therapy may be something that, hey, could be an option, and it's not
Yeah.
that scary.
No, it's not. It's not. I can promise you, and I know all of these pelvic therapists with Pro Rehab personally, and it's an amazing, highly trained, compassionate, caring group of clinicians.
Mm-hmm.
And you won't feel awkward. A lot of times patients are referred, and then they carry around that referral, sometimes months to a year. And they finally make it, and I'll see the date on the referral. I say, your doctor sent you like 9 months ago. And like, yeah, it just took, I just needed courage, to finally come in.
Mm-hmm.
So if you're feeling that, one thing I will tell you is call Pro Rehab, ask for one of us, ask for me, I'm fine with that, or ask for any of the pelvic therapists. And we will talk to you on the phone and explain things to make you feel more comfortable about coming in.
Mm-hmm.
We are happy to do that, because
There's no judgment.
no judgment.
Yeah.
Yeah, at all.
Susan, just if folks are just joining us, just one more time, if you can, because our viewers have increased as we've been streaming, but just the connection between pelvic floor dysfunction and mental health, there is a connection there.
Huge connection. Whether it doesn't matter what the symptoms are, but when you have pelvic issues, it affects your personal, intimate life, your social life. And even how you value yourself and what's wrong with me. And you're not a defective person. These are no more defective than somebody that needs a total knee replacement. Okay, their joints are not great, but there's treatment for it, and you can do, address it. So, here's another point too, very interesting. All you people out there that grind your teeth, TMJ, migraines, tension headaches, there is a very deep connection. The two most common places that the human body carries tension, and this is medical proven, the top of the spine, so that's your teeth grinding, tension headaches and all of that, and the bottom of the spine.
Okay.
So let me just throw out there, yes, there are some pelvic pain conditions that are absolutely driven first and foremost by stress and anxiety. How many times do you hear about, when I'm under stress, I'm constipated. When I'm under stress, my whole gut is affected. And then people, when they're under stress, and nobody will talk about this. I just evaluated a new patient yesterday for this. This gentleman is trying to explain, and this person has a very high stress job, and right, that randomly out of nowhere, it feels like someone has stabbed them in their anus, like an ice pick.
How?
It's a Charlie horse. Let's put it in pedestrian terms. They're having a muscle spasm in the pelvic floor. Well, this has been going on with this patient for, I don't know, over a year, I think. And so
that's a long time.
It's a long time
with that pain.
And it's horrible. And they'll be in a board meeting and they have to hide the fact that they're having this searing pain. And so you look at I see a lot of this, high stress jobs and pelvic tension and pelvic pain. And so which came first, the chicken or the egg? Look, I can't take away people's stress, but we can teach them how to manage, just like you can learn how to manage tension headaches in physical therapy, or some of the TMJ and all of that. You can learn how to manage the pelvic pain within your stressful environment.
Is this physical therapy something that I'm going to have to do for my whole life? Is this, I'm going to come and see you and you're going to teach me how to do things and I can get better?
Yeah, I don't feel like I did my job very well if you have to keep coming to see me. So my goal is to get people where they're about 70, 80% improved. And then usually we hand it over to a home program, and then it's maintenance, and they take care of it. And people are like, well, am I going to have to do these stretches and breathing exercises and all of this the rest of my life? Maybe, but if that's the worst thing you have to do, it's sort of
better than having to wear a diaper, or being embarrassed, or not going out and socialize, or like the woman who said she couldn't see her grandkids.
Right. So it's no different than someone who goes to physical therapy because they have lumbar disc issues. They have disc bulges, maybe even a little herniation. And they go to physical therapy, they get better, they don't need surgery. That person, though, is always going to have to use good body mechanics, keep certain muscles flexible, hamstring, piriformis, back muscles. So yeah, I mean, in order to stay out of that back pain, you are going to have to do some things long term. But I mean, if that's the worst thing you do, so you don't have to deal with, then do it.
Yeah, do it. So if I'm having issues, do I have to get a referral to see a physical therapist like you, Susan, or can I just call you up and say, hey, you know what? I'm having this issue. Can you help me?
Kentucky. Well, we have locations in Kentucky and Indiana. So a lot of insurances that you are able to direct access refer. So you can just refer yourself. It really depends on your insurance. So if you have like a state or federally funded plan like Medicare, Medicaid, Passport, which we do take all of those insurances, you do need a doctor's referral. But a lot of private insurances you don't.
Okay.
So what I would do if you have a private insurance is just call the clinic and just ask, and they'll tell you whether or not you need a referral. And yes, insurance covers this. This is not experimental. This has been around. It predates me. It's been around forever. And I think we're the only developed country in the world where women aren't automatically referred after having kids for pelvic therapy.
Isn't that like what?
I know.
Because I think about it when I went through it, and it's just like, yeah, that was something I didn't really understand what was happening. And we're kind of forced to just like figure it out yourself.
Figure it out, or even C-section. They should go for post-op. Any other orthopedic surgery, if you had rotator cuff repair.
You're going for PT.
Right. But somehow when it comes to genitalia or pelvic area, it's, you'll be fine. Let us know if there's a problem. And that's so crazy. You wouldn't say that.
I think that goes back to our mentality of like, let's just not talk about it, right?
Right.
Let's not talk about what's happening here. Like, this hurts now and it didn't hurt before. It makes me kind of mad.
It does. It is so funny. I was sitting on my couch at home and I see, you know, the commercials with your podcast and all of that. And then it just dawned on me like a light bulb. I'm like, I need to call her.
And I'm glad you did.
We should talk about this.
Yes,
like,
we
of
should.
all things, this is something we should definitely be talking
Absolutely.
about.
I think this is a really fascinating thing. And for folks who are out there who are like, you know what, I don't want to take another pill. I don't want to have to do this. I don't want to have to do that. Physical therapy may be a really good thing to look into.
Yes, it doesn't fix everything, but it fixes a lot.
Yeah.
And we're also really good about telling you, look, physical therapy isn't going to help you. You're probably going to need surgery. So we're going to get you ready for surgery with getting your muscles where they need to be.
Mm-hmm.
So no, it's not like a magical thing, but so thousands of people that don't get the care that they need because they just don't know that it's out there.
Okay. This was really just informative. Susan, is there anything that I did not ask you that you think folks need to know about today? You got time until 6:30. We could stay here forever.
All day.
I just told everybody that I occasionally pee on myself. So, it's out
you know
there.
What? Everybody does, and you're not alone. And you could probably walk through this building and there'd be people there.
Yeah, actually, there are several women of my age, and we kind of joke about it. Like,
yes. Well, that's just it. It becomes a joke, and we laugh about it with our girlfriends, especially.
Yeah.
Until it's not a joke, and then it's a problem, and then all of a sudden we shut up about it, and that's where it starts to get mental. And all of that. But no, I think the biggest thing is just don't be afraid to reach out. Please don't get on crazy websites.
I know.
There's horror stories and stuff that you can't. I know this is a shocking statement. You can't trust everything on the internet.
I know. Who knew?
Who knew? So you have questions. If you think, I even have physicians that will call and say, Susan, is this an appropriate patient for physical therapy, pelvic? Yes, you know, I'm not like, oh yeah, we treat that. So yeah, if you have questions, just call.
Okay.
Pick up the phone and call. I'm not intimidating. You can ask for me.
Oh my gosh. You are a breath of fresh air to be able to speak so comfortably and not like shy away from saying things. It's we all say it, but then we think we can't say it out loud,
right,
in an office or to somebody else or to our partners, you know, like,
right.
It feels like so just, I got to keep it inside.
I know. So don't.
Susan, this was fun.
Thank you.
I
enjoyed it.
I enjoyed it too. Thank you. So thank you so much for sharing this. Again, I've put Susan's link at Pro Rehab on this link. You can check out more information on pelvic floor issues, how you can get into physical therapy if that's something that you're interested into. I thank all the viewers who are joining us and those that ask questions. Thank you so much. I'm Myra Ansari with Susan Dunn. Have a great day.